New at 11. November is Lung Cancer Awareness Month. Lung cancer screening rates in general are shockingly low, with only about 1% of Californians eligible for lung cancer screening actually getting screened. The UC Davis Comprehensive Cancer Center is working to change that. I talk one-on-one with a doctor about how cutting-edge machines like this one and knowing your risks can save your life.
Anybody can get lung cancer.
80 to 90% of all lung cancers are caused by smoking.
And unfortunately, California is the worst state in screening. We screen only 1% of the eligible patients, and the nation average is only 5.8%.
You don't have to smoke to be at risk.
We're finding a lot of what we call driving mutations.
Meaning you could develop lung cancer through your genetics and family history. That's why experts at the UC Davis Comprehensive Cancer Center say screenings can be life-saving.
If you combine all the deaths from breast cancer, colorectal cancer, and prostate cancer, lung cancer is still the #1 killer of all the cancers.
Treatment breakthroughs, like this new robotic procedure at UC Davis, offers diagnosis and removal of lung cancer in a single surgery. You see here Dr. Phan at work using the new technology.
Anytime you go to see a doctor, it has the potential to be nerve-wracking because you might get some unfortunate news. But that unfortunate news that you might get may be a blessing in disguise.
The screening itself is relatively easy.
The CT is non-invasive. They lay down in the scanner, get the CT, and then go home.
Then, based on what the doctors see, they come up with a treatment plan if needed for each unique patient. With the 5-year lung cancer survival rate at just 25%, every test counts.
So if we screen more, I truly believe that we can get that 5-year survival up to the 50s, 60s, 70s, and hopefully 80s to 90% one day, like it is for the other cancers.
You'll also want to know about health disparities impacting Black communities. The experts at UC Davis also say Black men are 11% more likely to be diagnosed with lung cancer, and nearly 10% more Black men die from the disease. There are also new lung cancer screening guidelines recommended by the U.S. Preventative Services Task Force to help address health disparities and catch more cases of lung cancer earlier. You can read that information on our website, abc10.com.